Becky Thorson, time for Becky's Business Beat. And joining me today, Brenda Muller, Outreach Clinic Director with Windom Area Health. Hi, Brenda.
Hi, Becky.
What would you like to talk about today?
Well, today I'd like to talk about our upcoming Heart and Vascular Screens. According to Stanford Health, heart disease continues to be the leading cause of death for both men and women in the U.S., even though it's 80% preventable. And vascular disease affects many aspects of our overall health, but with advanced screening and technology, you can know your risk factors before symptoms ever develop.
So who should have heart and vascular screening done?
Well, the vascular screen is for patients who are 35 or older, especially if you have a personal or family history of cardiac disease, heart attack, or stroke. But type 1 diabetics should get the screening even a little earlier at like age 30. And the heart screening is for people who are 45 to 75.
And what do these screenings tell you?
For the heart screening, the screen includes a CT calcium score, an EKG, blood pressure reading, a cholesterol test, BMI measurement, and something called a Framingham score. This score tells you risk of a heart attack in the next 10 years. For the vascular screen, it includes a stroke screening, abdominal aortic aneurysm screening, and a peripheral artery disease screen. The stroke screen checks for buildup or blockages in the carotid arteries. The abdominal aortic aneurysm screen visualizes the existence of an aneurysm or an enlarged area in the abdominal aorta, which is the large vessel coming down from your heart that can rupture and be fatal. And the peripheral artery disease screen checks for blockage in the limbs, primarily the legs.
So what can I expect during the screening, and how are the scans performed?
As I mentioned before, the heart screening includes an EKG and a CT calcium score. So the EKG machine uses wires connected to a machine that records the electrical activity of your heart, and the CT uses a special X-ray scan to look for the buildup of calcium on the walls of the arteries in your heart. This analyzes the amount of plaque in the coronary arteries, which is a sign of coronary artery disease. The vascular screen uses ultrasound scans and blood pressures on your ankles and arms. For those scans, they'll have you lie down on an exam table, and a clear water-soluble gel will be placed on the skin of the area to be examined, and an ultrasound probe will be slid over your skin. The instrument causes no pain, but moderate pressure may be required on the probe to produce a clear image.
Is there anything one needs to know how to prepare for this?
So you'll have to be fasting for the vascular screen. This allows them to view the abdominal artery more clearly. So they'll ask you not to eat or drink or chew gum for 4 hours prior to the test, although you would want to continue to take your medications as usual, however. And also, caffeine can interfere with the accuracy of the heart test. So for that, you would need to abstain from caffeine.
And how do you get the results of the screening then?
Your results would be reviewed and explained to you at the time of your appointment, and a copy will be sent home with you. The final results of the heart CT scan may be sent to you once it's read by a radiologist.
And so do you need to have a referral to have these screenings done?
These screenings do not require a referral if you're 35 and older for the vascular screening and 40 and older for the heart screening. But if you have a strong family history, they may perform the heart test on you at a younger age if you do have a referral from your provider.
So what if I had one of these screenings before? When would I need to have another one?
So the vascular test is suggested once every 3 to 5 years, and a heart screen is recommended only once every 10 years.
How much do the screenings cost?
So for a limited amount of time, they're only $25 for the heart screen and only $25 for the 3 vascular screens, so it's only $50 for both.
Wow, that's a really great deal.
Yes, it really is. So now is the time to do it. It's very important to catch things before the damage is done. Heart and vascular screens literally save lives. As I always say, preventative medicine is always the best medicine.
And when are these heart and vascular screenings held?
They're going to be held on Tuesday, August 17th from 8 a.m. to 4:30 at Windom Area Health Outreach.
And so how would I go about setting up an appointment?
The appointments are set up through the Sanford Center for Screening at 888-996-4673, but you may certainly give us a call at Windom Area Health at 507-831-2400, and we can get you the number as well. You may also check out our website at windomareahealth.org and follow us on Facebook for more information.
Lots of great information there. Screenings coming up Tuesday, August 17th from 8 to 4:30 at Windom Area Health Outreach. See all the details at windomareahealth.org. Thanks for all that great information, Brenda.
Yep, you're welcome, Becky, and thanks for having me.
There's Brenda Muller, Outreach Clinic Director with Windom Area Health. Get signed up for those screenings on Tuesday, August 17th at windomareahealth.org.